Hello and welcome to another educational segment with EliteHealth Medical and Wellness Center. My name is Jacquelina Lopez-Devine. In EliteHealth, we understand that information is power. And today we are going to talk about hospice and palliative care. And I have the pleasure to introduce Jacquelina Lopez-Devine, which is the Chief Executive from TrustBridge. Thank you so much, Jacqueline. A pleasure meeting you.
Thank you so much. It is an honor to be the chief nurse at TrustBridge, and thank you for having me.
You're very welcome. And you know what? We want to know more about hospice. And also, I understand there is a misconception about the services in hospice. And what is the difference with palliative care?
Okay. So the very first thing that I would say is hospice is a service that provides a broad spectrum of interdisciplinary care to patients who have been certified as terminal by 2 physicians, and terminal means they have a life expectancy of 6 months or less. Palliative care is a patient who could have a chronic illness or even an acute illness that needs supportive care, but does not have a life-limiting illness, or not necessarily, and does not have a 6 months or less prognosis. So that is the main difference.
That is the difference. So if I understand, when a patient is in an acute care or any chronic disease, that is when they need the care of the palliative care, and then the one that needs assistance during the end of the life, that will be hospice.
That's correct. And
so,
and here's an analogy that I use often. So if you pick up a textbook, the name of the textbook could be palliative care. Palliative care is the big subject. Within that textbook, there's a chapter called hospice, specializing in end-of-life care. Palliative care, they're both supportive care, but really the defining factor for hospice is someone that has been deemed as having a limited life expectancy and a terminal diagnosis.
Exactly. And that is one of the reasons why in my interaction daily with the patient, we talk about different kind of healthcare services, but when we started the conversation about hospice, they don't want to talk about that. And you know what I always said, Jacqueline, is I understand you like to talk about life. Life is beautiful, but life is limited.
That's right.
So that is when it's coming TrustBridge and help us to go through when we need it the most.
That's correct.
And what kind of services involve hospice and palliative care?
Thank you. So I would say the first thing that I would want to communicate to the community is that we provide the service that is driven by the patient's and the family's goals. So really, that's limitless as long as the patient meets the criteria for end-of-life care for hospice. So if you think about physician care, we can have a physician available, nursing care, a registered nurse, licensed nurse practitioner to help serve the patient in the home or wherever they live. Nurses aid, our nurses aides happen to be certified, so they give excellent care for things like activities of daily living, bathing, feeding, and then we have music therapy. We have one of the best programs in the world for music therapy, which has been known to help alleviate symptoms. We have chaplains, which, at the end of life, it is not an uncommon thing for people to seek spiritual support. And then we have social workers, amazing social workers that are there to provide counsel, not just to the patients, but to the families, and provide, sometimes it's anticipatory grieving support to the families that they assist with.
So basically, you coordinate emotionally, medical, also spiritual. There is therapeutic as well. So, and now is coming the next question that I am very concerned about. Is it expensive to have your services, and who pay for that?
So that's the beauty of hospice, in particular hospice. So hospice is paid for by Medicare or Medicaid, and it's paid for by Medicare Part A. There are some private insurances. Almost most private insurances have a statement that will pay for hospice as well. And palliative care is paid for Medicare Part B. So the other piece that I always like to talk about with our hospice, TrustBridge, is the fact that we have very generous people in our community that donate to a fund. So if you are not able to pay, it doesn't mean that we're not going to give the care. We will give the care because of this very generous fund that we have to be able to serve our community who cannot pay or doesn't have Medicare or Medicaid.
That is amazing. So that is basically hospice, what I understand, is a very generous services, and it's when you need the most. And let me bring another concern, because I have the experience of interacting with patients. They said, if I go or I take my family or my loved ones to the hospice, I'm going to lose my primary care physician. And especially in Elite, they have a very personal and close relationship with the primary care physician. So that is true. You can work in with the primary care physician as well.
So thank you, Jacquelina. That's such an important question.
Mm-hmm.
We take great pride in partnering with the physicians in the community that bring the patients to us that need our specialty care. And we let the physician, much like we let the patient and the family drive the goals of care,
Mm-hmm.
we let the physician tell us, how do you want to be involved? How do you want to communicate? Once the family says, I want my doctor to be a part of this journey, then we'll go to the doctor and say, we can communicate with you with every change, or we can tell you when there's a hospitalization, or, sometimes physicians will say very respectfully, you specialize in hospice and palliative care, just keep me posted if there's a significant change.
Okay.
So we will allow the physician to kind of drive that communication, but we welcome the partnering. We realize we're a visitor really for the 6 months, and you've been there for years. So we seek advice from the physician, sometimes when there are issues that arise, but we work as partners.
That is amazing to know, and it's something that I'm going to explain as well to the patients. And talking about the information to the patient, I'm pretty sure some of our patients in the community want to contact you. So how is the way that we can contact, or any phone number that we can call?
Absolutely. So there's two ways, but the phone number, it's 1-848-422-3648. That's 1-848-422-3648. There is also a website that is filled with a wealth of information. That's www.TrustBridge.com. And with regards to referral, yes, you do need an order to get admitted to hospice, but a phone call can be made by a family member, by a patient, by a nurse, by a doctor, anybody who thinks, this patient may need the hospice service.
And do you have any way that if the patient needs to talk more about TrustBridge, to contact to that number and have an interview, a one-on-one, someone that helps to understand better?
Yes, so the ladies and gentlemen that answer that phone line, they are expert in helping to seek out the symptoms that may qualify, and then from there we will set up an interview, and the interview is either an intake coordinator or a RN that goes out and does a full assessment.
And Jacqueline, just to be honest, that will be an excellent help from us as a primary care physician, because it's tough to talk about this. It's necessary, it's an excellent and generous benefits, but it's tough for us to talk. So we need an expert to explain, and that is an amazing information that you provide. And now is one of the concerns, which is the COVID-19 and the pandemic time. So TrustBridge is assisting the community in a different way?
Yes, so we've been dealing with this now in TrustBridge in particular for 5 or 6 months. And what I would say is that we are so fortunate that we had a robust, professionally run call center. And when I say professionally run, it is nurses that answer the phone, nurses that are trained in hospice and palliative care. And so what we saw was a shift in healthcare going from, face-to-face visits to telephonic, which is a big change anyway. But for us, it was seamless because we already had a robust care center with protocols on what problems patients have in the field. So they, at any point in time, 24 hours a day, 7 days a week, can call our nurses. They were able to troubleshoot problems, and then those nurses could guide the patient and the family to say, wait a second, now we need to send a nurse out. And then we have basically like an emergency room, that can serve patients in the home or in the facility where they're at. As long as we're allowed in, we have been able to send a nurse out that would then triage, and sometimes the patients end up in our care centers. We're very fortunate. We have 7 care centers in our areas that we serve. So at times, some of those patients have had to be transferred. And we actually have had to do COVID cohort units. We have, we started with 2, one in the south in our Boca Care Center, and then one in the north in a northern unit in Palm Beach County. And because the numbers have grown, we've actually expanded that to a couple other hospitals in the communities that we serve.
That's amazing to know. So now we know more about TrustBridge. And thank you so much, Jacqueline, for that information. And again, stay connected with EliteHealth. Go to elitehealth.tv, or you can call me. My name is Jacquelina Lopez-Devine. My phone number is 786-583-5411. And stay connected and stay safe. Thank you so much.